Hello, this is Jim Pellegrino. Welcome back to The Hour, and our guest on our second segment of the show is Sam Caligiuri, who is a candidate for the 5th Congressional District in Connecticut. And if I remember my map correctly, Sam, it's Danbury to the west, Waterbury in the center, Meriden to the south central, and New Britain dead center, right?
That's right.
It's a big sprawling district.
But then all the way up to the northwest corner.
Right.
41 towns.
41 towns.
The old 6th, which Nancy represented for 20 years, and the old 5th were combined in 2002. And a couple towns got pulled off into other districts. But it's basically the combination of what had been the old 6th and the old 5th.
And unfortunately, the reason, I think unfortunately, Sam, the reason why we went from 6 to 5,
We lost population.
we lost population
That's
in
right.
Connecticut, so they consolidated districts, right?
That's right. And in 2002, Nancy ran against Jim Maloney.
Nancy
who was
Johnson.
Nancy Johnson
Right.
was the incumbent in the 6th, ran against incumbent Jim Maloney from Danbury. They faced off. I chaired Nancy's campaign that year, and she won.
Yeah.
Yeah.
Well, for the audience's information, currently, Sam is a Connecticut State Senator. He's in his second term, former acting mayor of Waterbury, Connecticut, and a partner in the law firm of Day Pitney. And you're, as I recollect reading your bio, you are a Boston College graduate.
That's
So
correct.
you're an Eagle,
I am.
being interviewed by a Husky.
I won't hold it against you.
Here at Central.
We're all friends
here.
here.
At Central, neutral grounds in
That's
Central.
right.
That's exactly correct. Well, listen, we've got about a half hour together.
I'm
Sam.
excited about
We've
that.
got some good time together to talk about the issues. And, of course, because you're running for the 5th Congressional District, my conversation with you is not going to be so much state-oriented as it is going to be federally oriented.
Mm-hmm.
Although a lot of the issues, Sam, that we're going to be talking about transcend state and federal government when you come to health problems and budget problems, et cetera.
Sure.
But the first thing I did want to checkpoint with you, because I think reading your background, you had some fairly strong feelings in this area. So let me just get the question out of the way. As you know, in New Haven, the Pettit trial is taking place. And that was a horrific crime, and everybody knows it was horrific. And the first of the two characters is being, well, they're in the penalty phase now, Tim, right? So, I mean, you still are a Connecticut State Senator, and how would you vote? I mean, on the death penalty.
It's if there were ever someone who should get the death penalty, it's this guy. I'm a supporter of the death penalty, and he's a living, walking example of why we need the death penalty in Connecticut.
Mm-hmm. Yeah, as I was saying to Mark Boughton, the previous guest on the show, you probably could talk to the next 100 people that we meet out there, and probably an overwhelming population of the state would wish that for these particular people. Yeah, it's terrible.
Yeah, you know what? You can't be putting people to death willy-nilly, but you need a death penalty for people like Hayes.
Mm-hmm. Something that's so horrific that
Absolutely.
it's beyond the pale.
Yeah.
Let's talk about some federal issues. Clearly, and I'm going to frame this, Sam, to some extent that almost in hypothetical examples, but using real-world cases, that if you were there, how would you have voted? To give the audience an idea of where you're coming from,
Sure.
right?
Happy
So
to
let's
do
do
that.
like a little bit of a lightning round first and then get into details.
Okay.
If you were sitting there a year and a half ago, and TARP came up, which was the federal bailout of the banks, right? Mm-hmm. Started in the Bush administration, continued in the Obama administration, both came out strongly. You got to vote for TARP or the system's going to collapse. Without being overly simplistic about it, because everybody knows pretty much what it is now, how would you have voted?
I would have voted against that bill.
Okay. How about stimulus? $800 billion program. People are still walking around saying, where are the jobs?
I would have voted. I would have voted no.
You would have voted no. Did you see the headline that came out this morning that see who received some of the stimulus money?
Yeah.
75,000 dead people and people in prison.
Yeah. No,
Good old federal control over a program.
Yeah, and no meaningful help to the economy.
So you would have voted against that?
I would have voted against that.
Okay,
and by the way, I'm giving you these short answers because I'm assuming we're going to be able to go back and talk about
Yeah,
each
you can go
one.
back anytime you want.
Yeah.
The next one is a large issue. It's been passed already, the health care bill. How would you have voted for the health care bill, and why would you have voted for it, or why would you have voted against it?
I would have voted against it because it was the wrong way to do health care reform. It expands the Medicaid entitlement, which is already a program we're having a hard time to afford. It raises taxes. It cuts Medicare Advantage. It enlarges the federal government, and I don't think that was the right approach. We need to do health care reform. We need to increase access, control costs, but I think that bill did it the wrong way. So I would vote to repeal the bill or to defund it and to start again.
But you know what, Sam, if you were in Congress now, and I mean, I think if the number is 65 to 70% of the American public agree with you, right? So you're on the right side in terms of popular opinion. But Sam, you and I know the reality of it is, once you're sitting in Congress, if you win that seat, and you move to repeal, and let's say the repeal vote carries, it's going to the president. And he's going to veto that bill, which means there's going to have to be compromises made in order to push the good parts of the reform through and hold back what, in your opinion, would be the bad parts of the reform. Where do you see yourself in all that?
Well, if repeal...
Ain't going to be easy.
No, but nothing is. And right now I'm running for Congress because our country is heading in the wrong direction in a number of critical ways, starting with our economy. And if we don't send people to Washington now who are not afraid to stand up, even to their own party, and make tough decisions and say no when you need to say no, forge compromise where you need to forge compromise, I'm afraid that the damage being done right now is going to become irreparable in another 2 years. And I hope we'll have a chance to talk about that. I would vote to repeal, and if the president vetoes that, I'm going to vote to defund. And I won't authorize funding for it so that it effectively stops it in its tracks while we try to pull the best out of it. And there are a few provisions in there that I do like. But I would have handled the whole reform process
what are the
very differently.
What are the two or three that you like?
Yeah, the one that I like in particular goes to the heart of how I would try to solve this problem. From an access perspective, a majority of the uninsured work. And a majority of those people work for the smallest employers in Connecticut and nationally, which says to me that a major part of the access problem is that it's not affordable for the smallest employers to provide health insurance to their employees. So if that's the problem, why don't we use tax policy to change the economics and make it more affordable for small businesses to provide health insurance to their employees? You know, most small business people I talk to who aren't providing it aren't not providing it because they don't want to. Their margins are just already so thin, they simply can't afford it. So what I've proposed in Connecticut, and what I would do similarly in Congress, is a 50% refundable tax credit to small business for the costs that they incur in providing health insurance. That would dramatically reduce the cost of their providing it, thereby making it more affordable for them to do it, and I think in the process substantially increase access. Now, there's a provision that's similar to that in the bill that passed, but it's a far more limited tax credit, it's limited in scope and limited in duration. So I actually think that was a good provision in the bill. But instead of being a small part of the bill, it should have been the centerpiece of how we expand access, Jim.
Why do you think it's going to increase taxes and cost more? I mean, the story that came out was it's going to reduce cost and there's not going to be any new taxes. So you're saying it's really the opposite. Explain in fairly crystal clear terms to the audience why you feel that way, Sam.
Well, we're already starting to see the effects of it. I mean, the bill calls for a number of tax increases, hundreds of billions of dollars in tax increases in order to pay for it. So that's clearly in the bill. We're seeing clearly in the bill $450 billion in cuts to the Medicare Advantage program, which is affecting people and affecting seniors. But the primary way that they expanded coverage was through the expansion of the Medicaid program. And Medicaid is already a program that we're having a hard time affording at the current levels. And that's especially a big problem here in Connecticut. And the reason why that's relevant to the bill is because the federal government says we're going to pay the tab for this expansion of Medicaid for the next 10 years, if memory serves. And then after that period, it's going to go back to the states. Now, right now, our Medicaid reimbursement rates are so low in Connecticut that providers are threatening to pull out. Hospitals that have a high Medicaid population are being forced to consider merging or closing because they're balancing their books on a reimbursement rate that's far lower than the cost. Let me give you another key point. When I'm the ranking member on the insurance committee in the legislature. I spent, at my request, a full afternoon with healthcare insurance company actuaries because I wanted to really understand what drives the cost. When you're writing a policy, What's driving the cost?